Hey, welcome everybody to today's mini grand rounds. Chris Hanks is joining us from our Hilliard practice, and he's going to talk about a topic that's near and dear to his heart, insect-borne illnesses in Ohio. I know we're getting sort of close to the end of the summer months, but it's obviously a topic that I know my patients bring up fairly commonly. So welcome, Chris.
All right, well, thanks. So as Niraj said, I don't know if this is near and dear to my heart, but based on some recent experiences I had, I felt like this is a topic that might be interesting to talk about. I moved into a new house a couple of years ago, and then this last summer we discovered that the prairie grass that surrounds our yard is a great breeding ground for ticks, and my children came home with many of them. And also over the past number of years, I've had a lot of information and misinformation I've heard from different people, and so part of this was kind of self-serving to make sense of what's really going on. But I've had people talk about needing prophylaxis for Lyme disease, and I've had I had someone tell me that there was no Lyme in Ohio, and different things. And so I just felt like maybe this was a chance to talk about some of the what's real and what's not. So largely it's going to be focused on Ohio only. We're not going to talk about a lot of the other insect-borne illnesses that are elsewhere that might come to Ohio with patients who have traveled, except for very brief mentions of those things, and largely focusing on both tick-borne and mosquito-borne illness. So this picture is just to kind of, to talk about, our current location. So as I mentioned, around my house, I think we pulled probably 10 or 20 ticks off our kids this year. Most of them weren't actually in the kids yet, but were crawling around. We even found one or two just crawling around inside our house. I don't know how they found their way there, but as I was looking around at different stuff, I came across this, which kind of talks about how, so ticks tend to live in either wooded areas or in grassy areas that have a lot of either deer or rodents. So a lot of them will travel from, on mouse and other rodents, and so places where there are lots of field mice also tend to have a lot of ticks. And so as you look at, around where you live, if there's large wooded areas, if there's areas with, lots of brush or grass, they're much more likely to have ticks in those areas. And this just kind of talks about ways you can prevent them spreading to your home. I'm not going to go through those details, but I thought it was kind of interesting to look at and see what's recommended with the amount of space you need to kind of barrier them off. Something I haven't done yet in my yard. But moving on, let's talk about Ohio, and we're going to start with ticks, and then after we're done with tick-borne stuff, we'll talk about mosquitoes for a little while. In Ohio, and hopefully the pictures on the right project okay, there's a number of different tick-borne illnesses. Lyme is probably the most commonly discussed one, but Rocky Mountain spotted fever, anaplasmosis, babesiosis is really quite rare in Ohio. Ehrlichiosis we'll talk about a bit, and tularemia is also very rare in Ohio. But tends to come in outbreaks when it does happen in places. We're not going to talk much about it either today, but we could if we want. So ticks. I've been shown pictures like this a million times, and people always talk about dog ticks and deer ticks, and I can never remember what the difference between them are. When you start reading literature on this, most people refer to deer ticks as black-legged ticks, and I think that's an easier description to remember. In that, if they've got so if you look down there on the bottom left in the black-legged tick, or the deer tick, they do have black legs that, and those are the ones that carry Lyme and a few of the other illnesses we're going to talk about. The dog ticks, which are on the top, are a little bit larger. They tend to have more, multicolored ornamentation on their backs and have browner legs. They're mostly only active in the summertime, late spring and through summer. They tend to be in the grassy areas. This is the type that I was pulling off my kids all the time because we mostly have grassy stuff around our house. And they carry Rocky Mountain spotted fever, which we'll talk about in a bit. But the black-legged ticks are the ones that are going to be carrying Lyme, Ehrlichiosis, Anaplasmosis. No, not Ehrlichiosis, excuse me, Anaplasmosis. The Lone Stars, which also are in Ohio, are Ehrlichiosis. The other thing I'll mention is the black-legged ticks, which carry Lyme and other illnesses, are active throughout the year. I'll show another slide on this in a minute, but just because it's winter doesn't mean they're not out there. They're lower in volume but they are still active throughout the year as long as it's warm enough for them to be out and moving around. So just because it's winter doesn't mean you're safe. So we're going to talk about Lyme disease for a while here. I'm sure you guys are all familiar with Lyme. This is no new concept, but a review of kind of what to look for and what's going on is probably not a bad idea. So it tends to be separated into three kind of groupings of disease timing. The early localized disease is what we normally think about with the erythema migrans rash, the target rash. That rash occurs right at the site of the tick bite, and so if there was a known tick bite there and then you get a rash, it's much more suggestive that we're dealing with Lyme. If you don't know if a tick bite was there or not, then that leaves you a little bit of a guessing game. But if it's a classic rash, it's pretty convincing. Tends to happen most often about a week to a week and a half after the tick bite, but can happen as early as a couple days and as late as up to about a month after the fact. Other symptoms might include fever, some joint pains, but normally not a true arthritis with swelling and effusions. At this point, normally serologic testing is going to be negative. So if you've got classic findings, if you've got either known tick bite plus your erythema migrans or a convincing erythema migrans rash, then it's okay to treat without doing any testing because the serologic testing is probably not going to gain you much. Moving on in time frame, and we'll come back to some more kind of epidemiology stuff in a minute here. Moving on in timing, early disseminated disease means we're moving on from that localized stuff. Occurs weeks to several months after the fact, and this is where you start getting the cardiac manifestations with, you can get heart block. That can be anything from primary, or first degree to third degree heart block. Neurologic manifestations, including meningitis, cranial nerve palsies. The cranial nerve palsies can be bilateral, so you can get a bilateral facial nerve palsy. It can be unilateral as well. And this, I should specify as well that that's separate from, there's something called tick bite palsy or tick palsy, where there's a tick actively embedded in the scalp and causes cranial nerve palsy. And when you remove the tick, that almost immediately resolves. And so, if you ever see someone with this, and you see a tick, remove it. It gets better. We're not dealing with Lyme. We're dealing with something different. And I honestly don't understand the mechanism behind that. I'm not sure anyone has delineated that, but kind of interesting. And when you come across it, you'll maybe someone will see it sometime. Serologic testing at this point is useful. We'll talk a bit more about that in a minute, but it's normally an ELISA followed by a Western blot for confirmation, looking for IgM and IgG of the Borrelia. Important to note is treatment of these normally will resolve these problems. So the heart block will resolve, for example, after you treat. Meningitis and cranial nerve palsies will normally resolve after you treat, and so treatment still is very beneficial at this point. It's not just preventing further problems. Late disease tends to develop much later, months to years after the tick bite. This is actually how Lyme disease was found in the first place, is up in a town called Lyme, Connecticut, which is why it's named Lyme disease. The doctors were noticing lots of people coming in with big swollen knees. The arthritis is normally large joints, knees most common, often asymmetric. Often just one joint, and we're kind of tracing that back to them having had a bullseye rash in the past, and that led to ultimately finding the diagnosis, the causative agent, I think in about the 1960s. So it's less common, but certainly happens. Takes time to develop. You don't always have early signs before this. So the first manifestation can just be a big swollen joint, or rare, much less common, but possible is some Lyme encephalopathy where you get kind of a mild cognitive disturbance, and can also get some kind of polyneuropathy symptoms as well. So many different manifestations of the disease. The thing I didn't put on here is chronic Lyme, which is a much more controversial topic, but I'll bring it up briefly because people will, ask questions about it. There's no evidence to support a kind of post-treatment chronic Lyme syndrome or the need for the, long courses you may have heard of people being on for months or years of antibiotics. There's currently no evidence to support any need or benefit of that. The Infectious Disease Society of America and the CDC both recommend not doing long courses. Certainly there can be sequelae from, arthritis and things like that, so you can have ongoing pain. There seems to be a higher rate of fibromyalgia type symptoms in patients that have had Lyme. It's unclear what the link to that all is, but current guidelines do not support kind of the concept of chronic Lyme requiring long-term antibiotic treatments at least. It's more symptomatic treatments control. As far as organisms and so forth, as you guys probably know, Borrelia burgdorferi is a microorganism. It's carried in the black leg tick, like I mentioned. I didn't put all the, I could have put a million pictures on here, but the nymphal stage is the most common source of these. The nymphs are very small. They're often the size of a pinhead. So, these aren't something that you're going to walk by someone and see a big tick sticking out of them. Even an engorged tick will be fairly small still. The tick normally has to be attached for, it's thought to be at least 24 hours for transmission to occur. So, the risk is lower if it's been on shorter time. So certainly doing tick checks when you've been out in places where you have worries is a good idea. I mentioned testing with ELISA and then Western blot. That's serologic testing. You can do PCR from CSF or from synovial fluid if you're obtaining those. And treatment, as we probably all are aware, is doxycycline is your standard treatment. The exceptions to that would be, of course, if there's contraindication to that, either in young kids, pregnant women, then you can use amoxicillin or ceftriaxone, and in a setting where it's CNS involvement, so meningitis or encephalitis, ceftriaxone is the standard. As far as frequency of different symptoms, the erythema migrans and the rash is the most common kind of classic thing. Of course, there's a lot of the less specific findings of headaches and fevers and things like that are hard to pin down. True arthritis is about 31%, and Bell's palsy 9%, with the CNS manifestations being much less common. And so talking about Ohio, like I mentioned, I've heard people say, boy, there's no Lyme in Ohio and things like that. That's not true. It's not real common in Ohio. Of course, it's more common in the Northeast. The picture on the lower left here is looking at the counties in Ohio that have the tick present, the blackleg tick. So you can see Franklin County is included, but in the Northeast, it's not as widespread. And then the picture in the upper right is where they found Lyme within those ticks or within other vectors. And so you can see again that there is some Lyme in Ohio. It's by no means as widespread as other places, but it is endemic here in Ohio. And then as far as Lyme disease case onset and activity of blackleg ticks, looking at these different maps, the bars on there, the kind of hashed bars are Lyme disease cases. And then the red line is the nymphs, and then the black line is the adult ticks. And so you can see that the rise in nymphs, in the spring and summer is when you get the most cases. As far as distribution of age, it's kind of bimodal, with frequent cases in school-age children, and then another peak between about 45 and 60 years of age. I really couldn't figure out any good reasons why 45 to 60-year-olds are more likely to get Lyme disease, but maybe they're out there with their kids. I don't know. How
old are you?
This is very personal. 30. I'm not in that age range yet, but I had kids young. But you can see there is tick activity throughout the year, like I mentioned. So that's kind of a quick rundown on Lyme. You could spend hours talking about Lyme, but if there are more questions, we can kind of go into them at the end. Rocky Mountain spotted fever, caused by Rickettsia rickettsii. This is in the dog tick, so the larger one that had more ornamentation on its back you saw in the earlier slides. Very few dog ticks actually carry this. It's only in about 2% of them. And again, the tick has to be attached for at least a day for transmission to occur, which actually reminds me, I'm going to step back to Lyme disease for one more second. So the other thing that comes up is prophylaxis, and when should we prophylax for Lyme disease? And current guidelines suggest that in Ohio you shouldn't. And let me, the reason being that the rates of ticks having Lyme disease here is low. And, I can't remember the exact numbers, but I think, you need a prevalence of something like 20% of the ticks having Lyme. And so to prophylax, if they're coming from somewhere with very high prevalence of Lyme disease, like Connecticut or Northeast, and they know that the tick was in for at least 36 hours, then it's reasonable to prophylax with doxycycline. Outside of those settings, the recommendations right now are not to wait for symptom onset. So here in Ohio, unless they've traveled elsewhere, there's no reason to prophylax, is the short answer of that. So back to Rocky Mountain spotted fever, sorry. again, symptoms are going to be sudden onset high fever, headaches, myalgias, and then a rash that starts on the second or third day, tends to start around the wrists and the ankles and spreads to the rest of the body, includes the palms and the soles. Normally this will happen 3 to 12 days after exposure. Early treatment is really important for this, so being aware of kind of that rash pattern is helpful because early treatment prevents very severe illness. This can be life-threatening. Doxycycline, again, is your standard treatment. The only other studied treatment is chloramphenicol, which is less effective and really hard to get a hold of, apparently. I've never tried, but I guess most pharmacies don't carry it. Okay, Children's Hospital does. So if you ever need it. Children's Hospital will take adults, by the way. Okay. And so, again, mostly this is, as far as locations, I think, yeah, I do have that. Looking at, frequency, the darker red is the most common or the highest incidence of Rocky Mountain spotted fever. So it's kind of that band across, a little bit south of us. Not a lot here in Ohio, but certainly possible. And of course, people travel and pick these things up too. Anaplasmosis, a little bit less common, but important because this can often co-infect with Lyme. So it's in the same ticks as Lyme, and so it's not unusual for them to be transmit both at the same time. And symptoms are fairly similar, except you get a lot more kind of neurologic confusion that, early on. So onset takes about 3 weeks after the tick bite. You get fevers, headache, myalgias, nausea, joint pain, similar to Lyme, and confusion is very common. Can be pretty severe. One thing I read said up to about 50% of infected individuals are hospitalized. Luckily, treatment for almost all of these is doxy, so it makes our life really easy. If you think you've got a tick-borne illness, doxy is probably the way to go as far as treatment goes. This can also, and as far as anaplasmosis, you can do serology as well as CSF for it for diagnosis, but in most cases you're going to treat before you know the answer. And then finally, one other tick-borne illness here in Ohio is Ehrlichiosis. This is in the Lone Star tick, which I showed early on. It's got a single white dot on its back. Symptoms and treatment are almost identical to anaplasmosis, so it's kind of hard to know which one you've got unless you do testing or you have a tick to look at. But luckily, again, doxycycline gets you taken care of. So that's our quick rundown on ticks. We can come back to any questions at the end. Let me buzz through mosquito-borne stuff for a minute. Yes, I didn't think that wording, but now that you laugh, I see what I've done. Can I steal the mouse for a minute?
Yeah.
So I found this little this site quite useful. When you talk about mosquito-borne illness, one of the things I wanted to talk about is just what are the risks here in Ohio, and what are people's chances of getting it, or elsewhere. If you've got someone who's traveled somewhere else and they're coming back with symptoms, how much do you need to worry about a certain disease? And so this site really does a nice job. It's run by the CDC, and as you can see, you can look at the whole United States for it, and you can change which year you're looking at, and so forth. So I'm just going to trim down to Ohio to make this a little more simple. Whoops. And kind of walk you through a few things here. So the first thing we're looking at right now is human cases of West Nile virus in Ohio, and you can see, it's not real common. We're talking, 1 to 10 cases in a few different counties, mostly in places where there's higher populations of people. But you can also click through and look and, all right, well, if you look at where mosquitoes are, mosquitoes with Lyme disease are throughout the state, or excuse me, not Lyme, this is West Nile. You can also, click through other diseases. So St. Louis encephalitis, there's not really any. I will highlight Crosse, which we'll talk about in a minute, because there's more of that here. And also, interestingly, you can look at things like dengue and chikungunya, which I'm not talking about today, but I think this is interesting. There's no local disease of either of these, but you can see that there are cases that happen in Ohio of both of these, that people travel elsewhere and bring them back. And so you can't completely ignore those as a possibility in your patients if they've traveled to the right places. So anyway, if you're ever wondering, all right, my patient traveled to such and such place, what could they bring back? This is a nice place to go and at least look around and kind of figure out what you're dealing with. Just to highlight what kind of mosquito-borne illnesses happen in Ohio, West Nile is probably the most common, but this is 2015, there were about 34 cases reported of actual human cases. 2 deaths from it. Those were both in elderly patients who developed encephalitis. Interestingly, the next line down, you see asymptomatic blood donors. So they test blood donors. About 80% of people infected with West Nile develop no significant symptoms, and so it's very common to have been exposed and not know it. And so they do track that. And then they're testing mosquitoes throughout the state on a regular basis. They have mosquito traps. They do this with ticks too for the other illness that I was talking about. And you can see that, they test a lot of mosquitoes and do find positive samples throughout the state. This is some of the other illnesses. I'm not going to go into all the details, but I will highlight that Crosse, when we talk about it in a minute, Crosse virus happens more in Ohio than any other state in the nation. It's still very rare. They only had 15 cases in 2015. But we're the hotbed of Crosse virus, which I can't say I've ever come across. So West Nile, I didn't bring in mosquito identification information. If you really want to get into that, that's another conversation. But birds are normally your reservoir. Mosquitoes get it from the birds and spread it to us. Symptoms develop, either 3 days to 2 weeks after a bite. As I mentioned, most people don't develop symptoms. And even those that do, most of them are mild and probably aren't going to present to you, or if they do, you're going to assume they have some viral illness that's benign. And so it's rare we're doing testing for this. The situation where you would be, of course, is when you've got concern about neuroinvasive disease. And so they're coming in with meningitis symptoms or encephalitis symptoms and digging into that. The meningitis is clinically indistinguishable from other causes of viral meningitis. It's going to, your CSF findings are going to have some mildly elevated white cells, normal glucose, not a lot to lead you, and so not unreasonable if you're looking at that to consider testing for it. Encephalitis and acute flaccid paralysis are other reasons why you'd want to look for it, of course. And unfortunately, these neurologic changes can be permanent, so it's a big deal. The other problem is we don't have any treatment for it, and so identifying it doesn't necessarily solve the problem. It's pretty much symptom-based treatment. But you can test from serum or CSF for the IgM antibodies. It's normally about a week, 3 days to a week after the fact that they become present and last for several months. So if you're getting CSF and you're thinking of, you can always retest it on the CSF later after you've thought about it more. Cases, you can see these cluster towards areas of population because there's more people there. But it does happen throughout the state in small amounts. So the red dots are actual number of cases in 2015, and the blue coloration is frequency of cases over the past 12 or 13 years. Darker colors meaning more likely, so a little bit higher rates up in the northwest, excuse me. As I mentioned, Crosse is more common in Ohio than any other state, but we're still only looking at about 20 cases a year. It's pretty much in the kind of eastern Midwest and south, and not up in the Northeast. And also spread by mosquito. Symptoms, again, are going to be fever, nausea, vomiting, fatigue, and then it has encephalitis and neuroinvasive disease, can cause seizures, coma, paralysis. So again, if you're seeing patients with these, you're probably going to be seeing them more likely in the hospital setting. But testing CSF, looking for it, is reasonable in Ohio. And again, no real treatments, just symptomatic care. And then other ones you've heard of, St. Louis, Eastern Equine, Western Equine, really aren't in Ohio in significant amounts. The Eastern Equine virus is in mosquitoes in Ohio, but there have been no reported cases. And so at this point, probably much less likely. So I've kind of buzzed through a ton of information. I know these talks are always hard because how do you absorb all this? But hopefully, if nothing else, you take away a little bit of the epidemiology of what to look for. So at this point, I'm just going to open up the questions and see if anyone has anything.
Great. Well, it is a really important topic because patients bring this up fairly frequently. I imagine being a med peds physician, you might get even more just because the kids are, out a lot, and parents are always concerned when they see anything that resembles a tick specifically. So, does anybody have any specific questions they want to share with Chris? Well, no, this is good. So I'll just ask some basic questions. I can't remember if we went over this when we had our discussion about the Zika virus, but as far as what parents might be told about avoiding mosquitoes, what do you tell them as far as repellents and things of that nature?
And the same thing can be done for ticks, too, as far as tick avoidance. So obviously, insect repellent definitely helps. DEET is the most commonly used insect repellent. It does have some potential neurotoxicity to young children, so generally recommended to avoid below 4 to 6 months, depending on who you talk to. It is, it has to be reapplied frequently to be effective. It doesn't last for hours and hours and hours, so, plan to reapply if you're really trying to protect yourself. For ticks, you can use DEET on, DEET products on skin, and it will repel ticks to some extent. You can also use, there's permethrin sprays that you can use on clothing. It doesn't work on skin. The oils of your skin break it down. But if you're wearing like long pants, tuck your pants into your socks, etc., spray your clothing down, you're much more likely to repel the ticks. And so there are some things you can do to protect yourself.
And how long is the permethrin? Once you treat your clothes, how long does it stay active?
I don't remember. I'd have to look.
Because it's not each application. Like DEET, you have to apply multiple times.
But
I think
permethrin is longer because it's not wearing off the clothing as quickly. But I don't know the exact time.
Okay. I think it'll actually go through some wash cycles,
like
too.
wash the clothes a number of times. I think it's okay.
Yeah. Okay. Do you ever get called about parents wanting to know how to remove a tick?
Yeah, so tick removal is, of course, a hotbed of interesting ideas. Yes. You'll hear about, sticking something hot on them, covering up with Vaseline. I'm trying to think all the, nail polish, gasoline. I haven't heard gasoline. The recommendation is to use small forceps to grasp them as close to the base as they can and pull them out in line with how they went in. So ticks, if you look at them, are a very flat body with a very small head coming out the top end of that body. And, they'll normally be kind of hanging down in a certain direction. If you pull them out that way, they're likely to come out better. It's not unusual to leave parts of the tick in when you pull it out. The tick head is very small and will often pop off. You should not go digging around trying to remove that. You're more likely to introduce infection than the actual tick head being there. Avoiding heat, avoiding things that cause the insect stress, like the tick stress, like covering it up with, whatever product you may have heard of. All those will make them more likely to expunge their blood meal and increase risk of transmission of infection. So the most common questions I get are either how do I remove it, or there's still a tick head in there, what do I do? Maybe put some antibiotic ointment over the top and leave it alone.
And are there kits that store, because most people don't have little fine needle nose
I don't
tweezers?
I've never looked, but if they don't have them, it's very easy to do in the office.
Eyebrow tweezers.
Eyebrow tweezers, that would work fine. I mean, you don't need any, it doesn't need to be some special tweezers.
I have red ones there, it's very...
I know, I can tell. Your beautiful eyebrows. All right, other questions? Back to being serious here. Any other questions? A lot of this probably comes up in the hospital when you're taking care of patients with, concern about mental status changes and doing lumbar punctures as far as the viral illnesses.
Yeah, I wonder if we shouldn't be looking for more of those things when we do LPs for people with acute look for Ehrlichiosis.
No, I don't spend much time in the hospital. I don't spend any time in the hospital anymore, so I can't speak to that as much. But certainly it did make me, as I looked at the different possibilities, it definitely crossed the mind.
Right.
Maybe I talked about this before I came in, but the Ohio law about Lyme testing, did you guys address that at all?
What do you mean?
Isn't there some law about informing people when you're doing tick testing? I don't remember.
I don't know anything about that.
No.
So I'm not aware of any Ohio law. You're absolutely, talk to your patients and test them if you think it's appropriate. But I'm not aware of anything driving that.
Yeah, a new notice effective September 15th requires physicians to provide written notice. Written notice to all patients who are tested for Lyme disease. Required language is your health provider is ordered a test for the presence of Lyme disease. Current testing for Lyme disease can be problematic and may lead to false results. If you are tested for Lyme disease and the results are positive, this does not necessarily mean that you have contracted Lyme disease. In the alternative, if the results are negative, this does not necessarily mean you have not contracted Lyme disease. If you continue to experience symptoms or have other health concerns, you should contact your healthcare provider and inquire about the appropriateness of additional testing or treatment. The State Medical Board of Ohio has developed a form to comply with the law, and they have a link.
This is probably getting at all all the evaluations that go on for chronic Lyme disease for people with fibromyalgia symptoms and trying to decrease the number of referrals to, ID clinics that overwhelm.
Yeah, so I wasn't aware of that law. I guess you should make sure your patients know if you're going to test them for Lyme, but hopefully they know that.
Yeah.
I don't know if that's still current. I know they were trying to repeal that. I don't know if that's...
Like I said, so the IDSA went through a re-review of their guidelines a few years ago because there was enough people bringing up concern. The IDSA has pretty much said, we don't need this chronic Lyme treatment stuff. Let's get away from that. And there was enough uproar from certain populations, apparently, that they did have an independent review, brought in totally separate physicians, and did this big process and confirmed every single guideline out there. So there's still no suggestion that we should be chasing chronic Lyme for long-term antibiotic treatment and so forth.
Okay. Well, hey, I want to appreciate everybody joining us today. Chris, I think it was a great presentation, and we'll have these posted here hopefully within a week, and we'll send a survey out shortly. Thank you.
Thanks, everyone.